Hello and welcome to this video on case studies for medical students. Today, we'll be exploring some interesting and challenging cases that I've come across in my studies, and discussing the diagnosis, treatment, and outcome of each one. So, grab your notebooks and let's get started. First up, we have a case of a 34-year-old male who presented with severe abdominal pain, nausea, and vomiting. The patient's medical history revealed that he had been experiencing these symptoms for the past few weeks and had been to several doctors without a clear diagnosis. After conducting a physical exam and a series of tests, including a CT scan, we discovered that the patient had a perforated appendix, which was the source of his symptoms. The patient underwent an emergency appendectomy and made a full recovery. This case highlights the importance of conducting a thorough physical exam and using multiple diagnostic tools to reach a diagnosis. In this case, the patient had been misdiagnosed several times before the correct diagnosis was made, which could have had serious consequences. This also shows the importance of considering all possible causes of symptoms, even if they seem unusual or unlikely. Next up, we have a case of a 56-year-old female who presented with chest pain and shortness of breath. The patient had a history of hypertension and smoking, and after conducting a physical exam, electrocardiogram, EKG, and a cardiac catheterization, we discovered that the patient had suffered a myocardial infarction, heart attack. The patient underwent angioplasty to open the blocked artery and was started on medications to reduce the risk of future heart attacks. This case highlights the importance of considering risk factors, such as smoking and hypertension, when evaluating patients with chest pain and shortness of breath. It also shows the importance of conducting timely and appropriate diagnostic tests to confirm the diagnosis and determine the best course of treatment. And finally, we have a case of a 17-year-old female who presented with a rash on her legs and arms. After conducting a physical exam and a skin biopsy, we discovered that the patient had a condition called vasculitis, which is an inflammation of the blood vessels. The patient was started on a course of corticosteroids and other immunosuppressive medications, and the rash gradually improved over the course of several weeks. This case highlights the importance of considering all possible causes of skin rashes, even in seemingly healthy young individuals. It also shows the importance of conducting appropriate diagnostic tests and starting prompt treatment to prevent potential complications. Well, those were some of the case studies I wanted to share with you today. I hope you found this video informative and educational. If you have any questions or comments, please leave them in the comments section below. And don't forget to like,